How does the use of a doula affect birth outcomes? A doula is a person who is certified and experienced in providing a mother with emotional, physical, as well as informational support during her pregnancy. A doula, however, does not provide medical support. A doula typically visits the mother during the prenatal months, during labor and birth, and once after the baby is home. There have been several studies in recent years that investigate the benefits and the outcomes of using doulas during birth. These studies have looked at the benefits and outcomes when the doula visits during pregnancy, birth, and postpartum phases of the pregnancy. Women who come from a lower class or are from a racial minority group typically are at a greater risk of experiencing poor birth outcomes in regard to birth weight and C-section rates, as opposed to white women who come from a higher class. Many of these studies look into the baby's health status in doula-supported births versus non-doula supported births. Some major aspects that we should look into when analyzing these studies are the methods, the types of data collected, and the limitations. The methods in these studies range from the meta-analysis to anecdotes, and some of these studies collected data from doula visits, which were qualitative and took information about the mothers from the databases, which were quantitative. Most of the data, however, were only in regards to the baby. The types of data collected were mostly qualitative data from the mother's demographics, and the rest was quantitative, including C-section rates, birth weight, preterm births, and the amount of intervention rates, which include Pitocin and other things like that. And lastly, the limitations would be that most of the women in these studies, well, all of these women in all of the studies that I have read are volunteers. And some of them did not complete the entire study. All of the studies concluded that the use of a doula during pregnancy does have beneficial effects on birth outcomes. Although some studies have showed that there is no statistical significant difference between the C-section rates in doula-supported births and non-doula supported births. However, other factors such as birth weight do seem to be significantly significant between doula-supported births and non-doula supported births. Women who had a doula-supported birth are also more likely to initiate breastfeeding and initial contact, which are very important in the baby's development. Initiation of contact right after childbirth is important because it helps to create a bond between the mother and her baby and regulate the body temperature of the newborn. Preterm births are also lower in doula-supported birth groups in many studies. Some major themes that tie into doula's work in birth include medicalization, McDonaldization, and the organizational theory. It has been shown the amount and frequency of medical interventions during a woman's birth has been increasing, as well as the C-section rates. Women who receive social support during birth experience the same level of pain and anxiety relief as those who receive only medical treatment. McDonaldization is when the processes of birth become standardized to make it more efficient. McDonaldization encompasses efficiency, calculability, control, and predictability, which can be seen when the mother is taken in for a C-section rather than a vaginal birth. Working with a doula is typically outside the normal range of McDonaldization practiced within hospitals because The hospitals rely heavily on the obstetricians for maternity medical support. Organizational theory can be seen when a doula is part of a mother's team as she prepares for birth. All of the providers on the team have the same goal in mind, which is to produce a healthy child during the birth. However, each member brings a different approach and expertise to the organization. So there has to be a compromise when dealing with these different strategies to obtain the same goal. Overall, the use of the doula during birth can produce a positive effect, such as healthy birth weight and avoid preterm births.